It's very important that the NHS evolves. Firstly, because that's what patients tell us they want. They want more personalised care. They don't want to feel that the hospital is some anonymous factory where they have no choice and no control. Secondly, we find it's much better for patients if they get their care at home, in their own environment. People recover more quickly from major surgery, their rehabilitation goes much better if they're in control of it in their own homes. And thirdly, hospitals are very expensive places to run, and we need to keep them for the most acutely ill people, for the care that can only be provided at hospital, and be as efficient as possible. What you're about to see are 3 award-winning services that tell the exact story of care closer to home, how new technology can support people make choices and live better lives. The haematology service in North Tees is a great example of empowering patients, giving them access to instant expert advice so they can feel comfortable looking after themselves in their own homes.
I'm Philip Mounter, I'm a consultant haematologist at North Tees and Hartlepool NHS Trust, and I look after patients with all blood disorders, including malignant disorders such as leukemia and lymphoma, so blood cancers. When I began in the Trust 9 years ago, we were sharing a ward with respiratory patients as well, which wasn't an ideal mix, and it was a large 30-bedded ward. And thankfully the Trust then supported us with moving to this smaller unit, which consists of 8 single rooms, which is better for patient comfort and also for infection control as well. We've been able to individualise care for patients and also been able to focus on patients' needs, offering services such as key worker and also allowing more time at home. Patients can then ring up if there is a problem. So they have to be sure that they can ring, they'll get somebody that they know, somebody who knows their condition, and then can arrange urgent assessment on the unit.
I could see a difference in him actually when he used to come home. He would relax as soon as he got into the house. He ate better, and I think just in general he just felt much more comfortable in his own bed and in his own home.
Obviously this unit is open 24 hours a day, 7 days a week, and patients can come in at any time and can come in quite unwell. So we developed protocols where patients being admitted with infection could then be assessed by the specialist nurses on the unit, and then decisions about treatment could be made in conjunction with the consultant on call, who we contacted any time of day or night by telephone.
They give us advice over the phone. Said if it got any worse, or if this happens or that happens, come straight in, you know.
The nursing staff on the unit were trained appropriately, and they're all specialist nurses in haematology now, who can then assess patients when they come in acutely, but also their role is there to educate the patients as well and to counsel them about what they might expect during the treatment, and also what to look out for when they are at home.
They gave me information about his temperature. I had to test his temperature to make sure that that was okay. And if it dropped lower than a certain level or went higher, then I used to ring them up and they'd talk me through what to do. And so, you know, after the first time, I wasn't nervous about it at all because I knew that they were there. And that was just like a comfort blanket really for me.
The next film you're going to see is a service in Sunderland which shows how telemedicine can really help patients manage their own conditions in their own homes and share data about their conditions with their doctors.
About 2 years ago, the PCT, in partnership with the local authority in Sunderland and Gateshead, decided to purchase telehealth equipment to help patients monitor their own signs at home. This equipment's mainly used with patients who have what are called long-term conditions. That might be like chronic obstructive airways disease, or heart failure, or diabetes mellitus, or perhaps people who have a problem with their blood pressure.
My long-term condition is chronic heart failure, and so this equipment is particularly to help monitor my state of health. The cuff you put on your arm, you press this button, it inflates when the blood pressure has been measured. It will transmit the message to this other machine.
Your blood pressure is 133.
If there's an alert, that means the readings are outside a normal range, then the community matron will be contacted who would look at that and make a decision about what's the next step in the treatment. For the patients, it's more convenient. They haven't got to make an appointment to go to the GP, or in terms of it can support an outpatient appointment. They can monitor the signs at home, they get a regular update, they can understand just how their disease is progressing or improving.
It has helped me personally because it has saved me at least hospital admission on one occasion.
The broader aims are to help patients remain independent and in control of their health. Also to help people not to have to use other health services inappropriately, such as having to go into hospital when they can be managed better in another way, certainly within the community.
I think it is very important for me and for many patients to be able to do things at home rather than to travel to the hospital, because it means you are spending at least 3 or 4 hours of your time attending the hospital, traveling time, parking the car or somebody taking you and waiting for the clinic, etc. Whereas the nurse can monitor your state of health here at home.
It's not in replacing doctors and nurses, but it's actually helping them to do their job. For the community matrons, it gives us a record of how people are in various stages of their illness, understanding what their vital signs look like.
It empowers me to do these things in the comfort of my own home, where I'm a bit more relaxed and I have a bit more time to myself.
In this third film, we see GPs working with older people, often living in nursing homes, making difficult choices about the way they want to live their lives and the use they want to make of the NHS.
What the project entails is patients living in care homes being offered the opportunity to have a structured discussion with their GP about their care preferences and how they would like to be looked after should they become unwell. Those preferences are then documented alongside other significant medical and social information and written down in a patient-held care record.
We wrote the plan between us, and I've received superb care ever since. I've just received the treatment that I needed at the time and recovered at the level that I expected to recover.
The main aims of this project were firstly and foremost to empower patients in their care decisions, and furthermore to enable more patients to be able to die in their preferred place of care. GPs recognise the need to reduce unnecessary admissions to hospital and see this as a way of achieving that.
My wish is to die here if it's at all possible. If the doctor could be present here when the time comes, that would be my delight.
Feedback from patients has been extremely positive. Most patients are very keen to be involved in these discussions, and they value having a personalised care plan that they can then discuss and share with their family and relatives. They also value the reassurance that their care wishes will be communicated to other clinicians and that their wishes will be respected as far as possible when the need arises.
I've had a wonderful life, and if it has to end, it has to end. And I just want to approach my Maker in the manner that I should approach him.
So far we've delivered advanced care planning to more than half of the population of care homes within West Northumberland. What we are now starting to see through this project is a levelling off of that rise in admissions, and hopefully over the course of the coming months and years we'll see the number actually starting to decline.
The hospital arranged that my wife should go to a nursing home when she was failing. And that nursing home was absolutely superb in the way that they treated me and my wife during her last days. I was actually stroking her hair when she died.
We would be very keen to see the project expanded to other groups of patients, particularly to the housebound and patients with chronic diseases.
A busy hospital ward is not the place where I would wish to end my days.